Well, the FDA with a warning tonight about a particular COVID test that's being used all across the Bay Area. They say the Curative, a self-administered oral swab test, has a risk of false negative results.
Yeah, KTVU's Ann Rubin has details with reaction from doctors and from the company that is defending its methods.
Hundreds of people at dozens of Bay Area locations get the Curative COVID test each day. But now a warning from the FDA that this test has, quote, a risk of false results, particularly false negative results.
The FDA doesn't do that lightly.
Dr. John Swartzberg, an infectious disease specialist at UC Berkeley, says physicians have reported complaints about their patients. It even happened on Capitol Hill, where Curative's oral self-swab was used to test members of Congress.
They lost their sense of smell and taste, and they ached all over. They had fever and a cough. I mean, they had COVID, and yet these tests were negative. And it was those kind of reports that led to the FDA investigating it, and they found that there were just too many false negatives.
Curative's founder, Fred Turner, just 25 when he launched his startup, released a statement saying, quote, "We are confident in our data and we're working with the FDA closely on the matter. Testing sensitivity and accuracy on behalf of our patients is at the heart of our work." The company emphasizes the test is only approved for people who are symptomatic.
A lot of the problem is water under the bridge, unfortunately. People who have been tested and have carried on their lives thinking that they didn't have COVID when they did, well, they probably spread it to a lot of other people.
Multiple Bay Area counties have partnerships with Curative. Santa Clara County says they're in discussions about the warning. San Mateo County plans to add information to their website. And Marin County says they're continuing their partnership for now. They all point out that no test is 100% accurate. Still, doctors say don't take this lightly.
You don't see FDA warnings like this unless they have a lot of data to support their concerns. So I would take those warnings very seriously. That until there's much more clarification, I would prefer getting a test from another company.
Again, the Curative test is only recommended for people with symptoms. If you have concerns about your results, doctors suggest you get a second test and continue to quarantine. Ann Rubin, KTVU Fox 2 News.